So, what is the best way to protect your heart? I get asked that question all the time. How can I protect my heart? I keep hearing all kinds of different things. Eat a high fat, low fat diet, eat a high fat diet, eat a keto diet, control your sugars. But what's the truth? What if all of the above could be true? And what if there was a simple way for you to get control of your heart? Why do we want our heart to be in good health? Well, guess what? It's what keeps you ticking, right? It's called your ticker for a reason. And one of the things that's strongly correlated with a healthy heart is good metabolic health. So we're going to talk about that today. I'm Dr. Rita Marie Loscalzo. Welcome back to the channel. And here we supply information and empowerment to help you make the best choices on how to empower your clients and patients if you're a practitioner, and empower yourself to make the best choices about how you live your life. We make choices all day, every day. And some of us are confused. We don't know what the best choices are because there's so many different YouTube videos, Facebook videos, blog posts, people doing sponsored ads and telling you, just eat this, just take that, and you're going to be healthy. So protecting your heart is the most important thing you can do, because if it stops working, you're not going to last very long. And that's what happened to both my parents. Out of the blue, they had heart attacks, and it turned out they were fatal heart attacks. And I didn't understand at the time why they didn't have warning, why their doctors didn't understand that they were at risk and talk to them about what they could do instead of what they were doing. But the truth is that for about 50% of men with disease, the first sign is sudden death from heart attack. Let me say that again. The first sign that there's a heart problem is sudden death from heart attack. And for women, the percentage is even higher, something around 65% of women. The first indication that you have, that your doctor has, that anybody has, that you have heart disease is you just die suddenly of a heart attack. And when you go to the research and you look up what is the most common cause of sudden death from heart attack, and I mean the underlying cause, not, the cause is obviously it's a fatal blow to your heart. There's what's called a myocardial infarct. You don't get blood supply to the muscle of the heart and it dies, right? But what's the underlying cause? The most common cause is, get this, insulin resistance. So what is insulin resistance and what does that have to do with heart disease? Well, let me take a step back. There was a study that was published in a Journal of Metabolic Disorders back in 2018. It was done by the University of North Carolina. And it put out that 88% of the population is metabolically unwell. We'll talk about what that means in a moment. Except when they did the update to that survey in 2022, last year, April of 2022, they found that 92% of the population is metabolically unwell. Metabolic unwellness, metabolic ill health, metabolic problems are the underlying cause of heart attacks, strokes, and other cardiovascular related deaths and illnesses. And it may not be so sexy to start dealing with, I'm going to prevent a heart attack. But indeed, that's what you need to do, because most likely you won't get warning. 50% and more in women never get a warning. They just die suddenly. And I know that this happens. It happened to both my parents. It happened to one of my grandfathers who came home from school when I was in high school, and I'm on my way up the street and there's an ambulance in front of our house wheeling my grandfather away. Never saw him again. Died suddenly of a heart attack that way. In his 60s. My mom and dad were young too. My mom was 56, my dad 64. It happens without warning. And I don't want it to happen to you without warning. I certainly don't want it to happen to me without warning. So as I started to dig into the research of how do we know, how do we figure this out, how do we protect ourselves, right? The subject of this live is protect your heart. Protect your heart, protect your life. And how do we do that? You take charge of your metabolic health. There's so many studies that show that elevated insulin, which nobody ever tests unless you're diabetic, elevated insulin is the cause of a lot of these heart problems. And I'll share some of that research with you. Elevated insulin. Most doctors don't test for it except in diabetics who've been diabetic a long time. They test insulin, but they're looking for low insulin so they know whether they need to put this person on insulin. So I want to share a couple of studies with you that were done in people who are diabetic and were on insulin. And what they found was that insulin treatment doubles the risk of cardiovascular disease in diabetics. That's insulin treatment. Now, does the body know the difference between you creating your own high levels of insulin or you taking insulin, shooting it up because you're diabetic? My answer to that is no. If you have high levels of insulin, that insulin is going to cause its damage, whether you produced it yourself or whether you're injecting it. And every 1 unit increase in that insulin dose increases the risk of cardiovascular disease 2 to 3-fold. 2 to 3-fold. Now, these were done, mind you, in diabetics. But my take is that there's no difference. If you're producing a lot of insulin because you're eating a lot of foods that cause you to need a lot of insulin, if you're engaging in activities that make you need a lot more insulin, it doesn't matter whether you're injecting it or whether you're producing it. You're increasing your risk of cardiovascular disease. Kaiser Permanente, one of the largest insurance companies, HMO, found that insulin exposure increased cardiovascular risk by 2.5-fold. And the longer the exposure, the greater the risk, which means if you're taking insulin over many years, you're at increased risk. But if you're producing more insulin over the years, you're at greater risk. So it doesn't matter whether you're producing it or injecting it. Saskatchewan Health Registry found a dose-dependent relationship between insulin exposure and overall mortality. It caused an increase in 2.9% increase in overall death. Overall death, right? From cardiovascular, from stroke, from cancer, from other things. And there were a couple of studies in a lot of people, 6,000 diabetics and 63,000 diabetics, that showed that you had a double, triple, and quadruple the risk of death from cardiovascular disease. The more insulin you're taking and the longer you're taking it for. So how long have you been injecting yourself with insulin? How long have you been eating a diet that is causing your body to produce more insulin? My take is probably decades. Depends on how old you are. If you haven't gotten your insulin tested, get your insulin tested. This is the single most important predictor of overall death from cardiovascular disease. So if you want to protect your heart, protect it from the ravaging effects of insulin. And you can do that. You're not diabetic, you're not injecting it, but you're injecting yourself every time you eat a cookie, a cake, a piece of bread, the pasta. You are increasing your chances of complications of high levels of insulin on the poor heart. Your poor heart cannot take this. So how does insulin affect this? Well, it's a combination of processes. The high levels of insulin affect what's called the endothelial lining in the blood vessels. So your doctor, your nurse, you know what those are. If you're just a lay person listening in, you're like, what's an endothelial? It's the lining of your blood vessels. It causes them to thicken. It causes them to become more stiff. And it causes them to be less able to deal with the stressors of, say, running for a bus or getting stressed at the end of a football game. The control of hyperglycemia. And this was in a study in, I don't remember the name of the journal, but I have a link to it on a slide that I have in front of me. And it was published in a Medline indexed research journal. And it said that control of hyperglycemia, high blood sugar, is the best way to improve your endothelial lining. Control of your blood sugar is the best way to control the health of your blood vessel linings. And guess what? You make choices every day, all day, on how you're going to control your blood sugar. It's totally in your control. Whether you're diabetic, not diabetic, have a family history of diabetes, are insulin resistant, or on the spectrum, are pre-diabetic, are pre-insulin resistant. Those levels of insulin, the levels of blood sugar, are the single most important factors in determining the quality of the lining of your blood vessels, how well they are going to conduct and move and contract and allow your blood to flow, how flexible they're going to be by a sudden rush of blood because you got excited about something, had to run away from something. You get to control it. You get to control the quality of your heart and your blood vessel linings. Is that good news or what? You get to control it. And the biggest causative factor in here is the amount of insulin that you produce and how insulin resistant your cells get. As a reminder, insulin is a hormone produced by the pancreas in response to rising blood sugar. After every meal, blood sugar goes up, insulin gets produced. Insulin takes the sugar and escorts it into your cells so your cells can make energy, ATP, and you get the energy, you get the energized effect. But over time, if you're eating foods, doing activities that cause you to have a rapid rise in blood sugar, you'll have a rapid rise in insulin, and you increase the risk of endothelial damage. You increase the risk of sudden death from heart attack. You increase the risk of myocardial infarction by 2, 3, 4, 5 times fold. Depends on how often it's happening and how much it's happening. So typically, when insulin is secreted, it actually causes vasodilation, expansion of those blood vessels. But when you've developed insulin resistance or pre-insulin resistance, your cells are no longer really responding to the signal of insulin. It causes constriction and thickening of those vascular membranes, thickening. There are large randomized control studies that establish a causal relationship between glycemic control, blood sugar control, and the development of vascular disease. So when I say to people, well, I talk to people about their insulin and their blood sugar, and they go, oh, you should talk to my mother. She has diabetes. My uncle has diabetes. I'm saying to you that unless you are ultra healthy right now and you're eating a really pristine diet and you feel great all the time and your waist is below, let's say, 30 inches in a woman and 35 inches in a male, and your hips are larger than your waist, at least 80%, or your waist is 80% of the size of your hips, and your fasting blood sugar is below 100 or below 90 even for ideal, if these aren't happening for you, then chances are good that you're experiencing the downside of insulin resistance, the damaging effects of diabetes when you're not diagnosed with it yet. It could take 30 years or more of this constant elevation in insulin and resistance before you develop diabetes. By then, a lot of damage is done. Some people don't even make it to diabetes because they die suddenly before that. I don't want that happening to you. So you need to be really aware of how you're taking care of your heart by how you're taking care of your blood sugar. Metabolic health is dependent on your blood sugar levels. Your blood sugar levels are critical. And it doesn't mean that, the doctor said I'm fine because my blood sugar is under 120. I'm not diabetic. You need to be keeping those blood sugar levels in the ideal range, and you need to be keeping them there all the time. And there's some peaks, and it should go up after meals, and then it should come right back down. So I encourage you to really take this to heart. I encourage you to understand this. If you want to go deeper with this and listen to my full presentation on this and see the slides, you can, we'll put the link in the chat, let us know. But we have a 3-part Road to Metabolic Recovery series. And the second part is all about cardiovascular disease and cancer and all the research that's done on this. I am here with a message. I am here to help you to realize that this is within your control. Cancer, heart disease, autoimmune disease, all of these are complications of out of control metabolic health, of out of control blood sugar and insulin levels. And guess what's so great? You get to choose. Every time you pick up your fork, you get to choose what you put at the end of it. You get to choose how high your blood sugar goes. We can help you with that. So go in and check it out. We'll put a link in the comments to the Metabolic Recovery series. 3 parts. We have 1 more part happening this week on Wednesday. Miss any, this series is available. So if you're just jumping in and go, oh, I want to hear that full thing on cardiac disease, it's like an hour plus, an hour, 15-minute presentation. You can get access to it. I want this information out there. I want you to hear. I want you to see. I want you to be aware of it. You have control. Your loved ones have control. You can help kids to stay off this path by getting your kids and your grandkids and your nieces and nephews to stop the body abuse that happens every time an American puts something on their fork. You know, yesterday was Super Bowl Sunday. I read a thing about all the gallons and gallons of soft drinks and beer that people are drinking, and all the popcorn and the potato chips and the chicken wings and all that people are eating then. And there is an increased risk of heart attack. There are increased incidences of heart attack the day of and the day after the Super Bowl. And it's not about getting excited and, having a heart attack because your team is losing. It's about what you're putting in your body. It's about your metabolic health. And when you can get on the road to metabolic recovery, you are going to protect yourself from all of these horrible diseases. You are going to get to live the life that you want to live. So I would say subscribe, whatever platform you're watching this on, subscribe. Let us know your thoughts in the comments. We want to get into conversation. And if you're interested, we'll put the link to the Road to Metabolic Recovery. We'll put it in the description. We'll put it in the chat. Okay? So you get to choose 1 meal at a time, 1 thought at a time, 1 night of sleep at a time. All of this plays in. And we have an upcoming program that we're taking already, a couple hundred people through this to help them to get back on that road to healthy heart function. You need to protect your heart, and every choice you make gets to do it. It's so empowering. I watched my parents die. I watched my siblings and I suffer. I was the oldest, and I was 35 when my mom died. My youngest sister was 13. My dad died 2 years later. She was a teenager and lost her parents. Never got to have her parents be around as an adult. I don't want that for your kids, your grandkids. I don't want that for anybody. It was extremely painful. And when I look back and I say, wow, what if the doctors had tested her insulin? Would they have found it elevated? My guess is yes, just based on looking at our genes and some of the other factors. Would it have saved her life? Could it have saved her life? Could she have saved her own life if she'd made different choices? I believe so. And I've learned from that. And I want that for you. So subscribe, watch the other videos on the channel, and I'll see you next time. And until next time, choose health, choose life, choose yourself. Thank you.